Senator, two bills related to the maternity care of pregnant mothers got off the floor tonight. Tell me a little bit about both of them and why they're important.
Well, SB222 is a bill that would require individual insurance policies to provide prenatal and maternal care. It's very, very important in these days of underinsurance, and more women are finding it impossible to find maternal and prenatal coverage in the individual healthcare market. So more and more women are going uninsured, and it's a very, very critical time, as we know, in prenatal development. So it's very important that these mothers and their babies get the proper treatment and the proper care. So this will actually save the state money. It will hopefully result in higher weight birth babies and healthier mothers.
And one would even kind of express surprise here in 2011 that this is an issue for a pregnant mother.
It should not be an issue. I mean, we're a civilized society, and the state of California is one of the wealthiest states in the nation as well as the world, and we should be able to provide these kinds of coverage. In fact, it will be part of the federal health care reform. So California is a little bit ahead. And we're happy about that. And one of the very nice things about this bill is it did not have opposition from the insurance industry. They were happy with the bill.
Well, and that's interesting because I know the insurance industry initially was looking at a lot of this as so many reforms coming out of the legislature, and it sounded initially like they had tapped it, but in fact that they are supportive.
Well, in fact, this has been a labor of at least 5 years by women's health care advocates. They've tried for many, many years before this to get this through the legislature and signed by the governor, and they were not successful. So we finally got it this far, and it will go on the governor's desk, and I really urge him to sign it because it's going to help women across the state, and it's going to ultimately save the state money.
Elaborate a little bit more on the whole issue of starting early with a child's future and how important it is with the prenatal care and how that can affect a child years on.
Well, I'm the mom of 3 children, so I can speak from personal experience. When a mother who is pregnant does not get the proper care, in other words, when she doesn't get the proper nutrition, when she doesn't get the proper vitamins, when no one is testing the mother's weight, and there are concerns such as diabetes and other medical conditions that can have an onset during pregnancy. When nobody is monitoring those things, it is hard on the mother and it's hard on the baby because the fetus may or may not be developing properly. There may be birth defects that can be treated when the baby is born, and it allows the hospitals and the doctors to be prepared for a baby that is maybe born with birth defects and provide the proper immediate treatment. Everything goes better when the woman is able to get the proper care and the proper treatment and the proper nutrition. Babies are born with higher birth weights, and that's critically important for infants, that they're born at the proper weight and that they be given the proper nutrition immediately upon birth. So all of this relates to how healthy babies are born and how they get their start in life, and that affects us, throughout our entire lives.
Let's talk a little bit about the maternity leave bill. And again, surprised that this is an issue for pregnant mothers in 2011, but what do you do here in terms of ensuring that?
SB299 would require that employers, when a woman is pregnant and taking maternity leave, which the state of California requires employers to give that kind of leave, that the employers continue to provide the health care that the mother would otherwise get. So it just continues providing health care coverage during maternity leave.
And again, this is an issue where mothers aren't taking their leave because of the concern?
Well, that's the problem. Obviously, mothers are going to take some time off when they have babies, but they have to cut it short because they're not covered by their health insurance, which is a real shame for everybody involved. The parents really do need to have the time that the mother needs to recover from giving birth, and she needs to nurse that child, and she needs to be able to spend some time bonding with the child. State of California recognizes that and mandates that these parents be given maternal and paternal leave, and yet we're allowing the employers to cancel their insurance coverage during that leave. So it doesn't make sense, but this law would close that loophole.